Good morning and welcome. Call to order the April 26, 2023. Going to move into executive session for 30 minutes to consider the selection of a site or the acquisition of real estate by lease or purchase in compliance with RCW 42.0.1101.
Right.
And then we have introduction to get that.
Yes, we have one guest staff member from Anna Ramos, who's our office technician, who has been hired recently. And welcome, Anna. Welcome.
Thank you. Thank you. Comment?
There are no public comment issued, and we don't have anyone in the public here.
All right. Thank you. So then we'll move to the consent agenda. And all items listed below are considered routine by the health board and will be by one motion. No separate discussion of those items unless the board member requests, in which event an item will be removed from the consent agenda considered in its normal sequence of agenda. Does any member of the board wish to remove a consent agenda item? All right, then I entertain a motion to accept.
Madam Chair, I move that we approve the consent agenda.
I would second that.
We have a motion by Commissioner Curtis and a second by Commissioner Levy to accept the consent agenda as presented. Would you read the consent agenda? I'm sorry.
Yes. On March 29th, 2023, Yakima Health District Board of Health meeting minutes, payment of accounts payable and payroll issued in March 2023 and amount of $5,888,071.
Thank you. So we have as presented, we have a motion and a second. All of those in favor, please say aye.
Aye.
Any opposed? Motion passes. Thank you. And we will move into our spotlight today, which is
Everybody. So today for our spotlight, we're going to be discussing our rabies surveillance program, which falls in our vector control program in EH, but it also does involve Melissa and her team some of the time. So we'll both be presenting on rabies today. But
start off, you'll see that throughout this presentation that rabies is not a huge program within the Yakima Health District, but it's certainly a very important one because it's usually always fatal. So rabies is a viral disease that affects the central nervous system. The virus is nearly always fatal. We put nearly in there because there have been a couple of documented cases where it wasn't fatal, but usually it's always fatal. So if appropriate medical care is not received. And it's transmitted through warm-blooded mammals, including humans. Rabies. Next slide. In transmission, it's transmitted through animal bites, scratches or lacerations, and also through mucous membranes or saliva.
we discussed rabies in different animals. Mentioned that warm-blooded mammals are all susceptible to rabies. Over 90% of the rabies cases in the U.S. do occur in wildlife. However, again, pet livestock can get rabies, and specifically in Washington State, bats are the primary vector for rabies. Some of the symptoms that we're looking at in rabies in animals is behavior changes. The primary one being aggressive or vicious behavior. The animal will appear obviously ill, not well, very uncoordinated, can't really walk a straight line, and then the typical foaming and drooling from the mouth. But early in the stages, the animal may not appear to be ill either, so it kind of depends on how it's progressed. The only way to know for sure that an animal has a rabies infection is laboratory testing of the central nervous system tissue.
question for you, Sean.
Yeah.
So if someone is exposed to rabies through a bite and that is not discovered, at what point does it become too late to administer treatment? And do they get symptoms like that?
Yeah, we'll talk a little bit about it later in the presentation, but once it attacks the central nervous system, it's progressed too far to be able to give any treatment, which can be anywhere from 2 to 8 weeks and up to a year, depending on where the bite is.
Next slide, please. So in Washington State, there has not been a lot of rabies cases, but we do have a timeline here of some of the past cases we've seen more recently. Back in the late 80s, we did see a case in a dog early nineties, of course, mid-90s. I'm debating if that's a llama or alpaca.
I was wondering about that too.
Yeah.
Struggling with that, all ages, yes. A domestic animal. In 1997 was the last human case in Washington State. 2015 was a cat. In the last 75 years, there have been 2 human cases in Washington State, one in 95 and one in 97. So like I've mentioned before, bats are the primary vector of concern. The main carrier of rabies in Washington State's wildlife. Typically, though, less than 1% of the bat population is infected with rabies. So looking at this timeline, we have not seen a lot of rabies cases in Washington State. Bats are pretty reclusive, they're nocturnal. There's a lot of them, but we just don't run into them that often. The opportunities to run into them mainly are if a bat is not well, not laying on the ground ill or dead or dying. So those are kind of the highest risk moments that we see. Next slide, please. So in the US, different regions of the US, there are different vectors considered that are the primary carrier of rabies. Here in the Pacific Northwest, again, it's bats, but that changes as we move into the central US and to the East Coast and southern parts of the US. Also learned that we have mongoose in the US. I did not know that. It's one of the primary vectors in certain areas. But the central US, we're looking at skunks as a primary concern, and East Coast raccoons are one of the primary vectors. Next slide, please.
Why is the only state in the US to not have rabies?
So comparing Washington State to the rest of the nation, see that our cases are relatively low compared to the rest of the US. No domestic animal cases. I believe this is from 2018. Compared to the rest of the nation, there's over 300. So again, I think that's related to the primary carrier of rabies is bats, and there's just not a lot of exposure to other animals to bats because they're so reclusive and their niche in the environment is so unique compared to a lot of other animals that would otherwise have more encounters with domestic pets and livestock. But in wildlife animals, we had 40, which is still relatively low compared to the rest of wildlife across the nation. Next slide, please.
So this is just looking at the symptoms of rabies in humans. After the exposure, symptoms appear usually in 2 to 8 weeks after the exposure. They include headache, fever, pain at the site, agitation or confusion. Again, depending on where the bite is located, the further away it is from the central nervous system, the longer the symptoms can take to present themselves.
So looking at prevention of rabies, protecting yourself, your pets, family. One thing, there is a vaccine available for pets and I believe livestock too in some capacities. So keeping up to date on your animals' vaccines is the primary mode of prevention. When you're hiking through the woods or exploring, I don't know if you go cave diving or explore caverns, we do have a few of them around the state. It's a good environment for bats to be hanging out. So keep pets leashed and supervised, or don't bring them into situations where there could be, bat populations in an area. Also limit or eliminate exposure wildlife with your pets, livestock. Don't handle or try to touch wildlife. And then a big one for around here is we do see a lot of stray cats and dogs in Yakima County. They're kind of all over the place. And we get a lot of bites reports at the health district, a lot more than I would say almost any other health jurisdiction. So, and it half the time it's, well, we found this stray dog and it was so cute, but it looked sick and I want to get it help and it bit me when I picked it up. So try to leave the strays alone, call them into animal control, humane society, veterinarian, try to get it the help it needs, but best not to handle stray animals. Next slide, please. So there's a series of partnerships that are in place to help this program operate because it doesn't get a lot of attention and nor does it require a lot of funding for the Yakima Health District here, but it is serious because if there is an exposure, then the odds are low that there is a rabies exposure. But if there was and someone was infected, it's nearly always fatal. So we have a program in place that tracks the progress from a person being bitten by an animal where we cannot rule out rabies, all the way to getting that animal tested and getting results back to the bite victim or the medical provider. So we all know next steps, and it happens within just a day or two. So we do have partnerships with local veterinarians to secure the specimens to send to our public health lab, the virology lab over there, to turn around and get a quick test result on suspected rabies cases. And then it's our local hospitals and providers know it's a notifiable condition. So if there is an animal bite, they can't rule out rabies. For sure that bite report is sent to the health district for our investigation and evaluation. And then we can determine what the appropriate next steps are. Next slide. But just touch on this a little bit, but the process that we go through is that our providers will report suspected rabies cases to YHD immediately. And they fill out the form that's attached to the slide here. As rabies is a notifiable condition. So when they fill out the report, the things we're looking for is the dog a domestic pet or is it a stray? Does it have a rabies vaccination? Was the bite provoked? A lot of that gives us enough information to rule out if this is a suspected rabies case or if there's what the next steps will be. For example, if we get a bite report and stray dog, no owner information, no vaccine information, the dog is in custody of the Humane Society, we may not have to actually send that animal off for testing. We may be able to quarantine him for 10 days. So unfortunately, testing is brain tissue. The animal has to be dispatched to get that test. However, our partnerships with the public health lab and our local veterinarians and medical providers make this process very streamlined, very quick and efficient to get us the information we need to rule out any rabies exposure. Next slide, please.
So if environmental health or a nurse determines that a patient does need treatment because there was a potential rabies exposure, the nurses coordinate with our local hospitals who have the vaccine and the human rabies immune globulin on hand. So that's part of our partnership. All three of our local hospitals have those on hand in their pharmacies to be able to treat individuals. If one hospital doesn't have something, we coordinate with the other to ensure that the patient, and it's a great partnership with all three hospitals to make sure that the patient is treated. They might receive one dose at one hospital, there are other doses at another one. The treatment is post-exposure prophylaxis, which is the immune globulin, which essentially produces like an antibody reaction within waiting for the rabies vaccine to be effective. So they get that first dose of immune globulin as soon as possible. And then they also receive a dose of the rabies vaccine and then additional doses of vaccine on days 3, 7, and 14. So our public health nurses are calling the providers and coordinating that with the hospitals, getting orders for it, and then following up the patient to ensure that they did receive their additional doses.
No, with the rarity of these cases, is it really, do the hospitals really keep current active doses every hospital?
They do.
Wow. Because it seems like with the rarity here, maybe it would be better just to have certain hospitals that we keep active and they can share.
So it's something that we have local, they make sure that they always have, and we actually do get, provide prophylaxis to probably 2 to 3 people every year. Because it's the one thing that you don't want to get wrong, you know? So
Okay, so you take precautionary steps.
we do. There's an algorithm that we follow that will be in a couple of slides, but it's not something that we just give everybody who had a bite, because it is very expensive. There is a limited supply of it. It's a lot of coordination, but there is an algorithm that's universal across the United States that we follow. But we always err on the side of caution if it's questionable.
You'll see if there's suspected cases that you still have to go through the regimen, which Melissa will share.
Okay, well, that makes more sense then, because I'm thinking, well, the last active case was 26 years ago, and like, okay, but if you're,
Yeah, occasionally you get this one that it just, you really highly suspect that it's possible, and you just, you don't want to be wrong on that, so.
okay.
So
Okay, so this is a flow chart here. There's a lot of information on it, so I'll kind of break it down to how we look at this and determine our next steps. So, for example, if we have a bite report, the animal is healthy, it's vaccinated, it has an owner. That dog got in fight with another dog, healthy, vaccinated owner. The individual who got bit was, reaching into the fray there to try to break up the dog fight and got bit. That's typically a provoked fight. We have healthy dogs in a heightened state that are upset and they just lashed out. That doesn't necessarily mean that that dog needs to be dispatched and tested. That would be a situation where, okay, let's be safe, just monitor your dog for 10 days for symptoms of illness. And we'll get back to you in 10 days to check in on the dog. Usually we can have the dog quarantine at home if it's healthy. We have a dog that's unwell, owner or no owner, but no record of vaccinations, and it lashed out at the owner randomly, or a guest randomly, someone visiting, no rhyme or reason to it. That we could classify that as unprovoked bite, and that would be the dog needs to be quarantined for 10 days. It bit somebody randomly. We would like it to be quarantined at a local animal shelter to monitor that dog and also get treatment if it's sick with something else. And then after 10 days, if symptoms are worsening and showing signs of rabies, then we would recommend the dog be dispatched to the neurology. And that could lead to prophylaxis depending on test results. However, we do run into situations where the dog, I should say the animal is not able to be tested for whatever reason. It's been deceased too long. The nature of its injuries didn't leave enough material behind to be tested. And we don't have the luxury of having a laboratory result to rule out rabies or not. And we have no records of vaccinations. That's a point where a bite, the environmental health team would give that information to Melissa and her nursing team. And we would then make the decision that prophylaxis is the only 100% way to rule out a rabies infection. So that's the route we have to go.
What's the shelf life of the prophylaxis for rabies?
Dr. Byron?
All pharmacies have to carry it, so one pharmacy has expired stuff, they may have sent for it, but not gotten it yet. Another hospital. State law or federal law. On one hand.
Yeah, and to follow up with your question, Commissioner, so we may not have a lot of cases here, but there is a lot of coordination that goes between LHJs from across the state and other states, because we have people who travel to Alaska or back east where it's more prevalent. They come home and they need to continue their series, and so there's a coordination that happens, and we ensure that they continue to get their series. And we've had that where we coordinate with other local health departments when somebody starts their treatment here but goes to another county or another state.
So the way I like to look at this flow chart is all roads lead to rabies prophylaxis unless there is a checkpoint along the way that 100% rules out a rabies exposure. So that's the way we look at it. That's the way we approach it. You know, we don't have to give a lot of prophylaxis, but like Melissa said, 2 to 3 a year. And it's better to get that part, better to administer it and them not need it than not administer it and come to find out it was needed. So it's a zero fail kind of effort, you could say.
I will add though that it's not required, you know, so like for active tuberculosis, it's mandated that you take these medications where the health officer can issue orders. It's not mandated if the patient refuses prophylaxis for rabies exposure, that's completely their right, so.
Next slide, please. But so looking at how they tie into the health district's strategic goals, this is, you know, notifiable condition we're dealing with. And through a carrier vector. So we are delivering in our mandated services by providing the rabies surveillance program here at the health district that rules out any exposures or gets people the resources they need if they were in fact exposed or possibly exposed. So that's we are delivering our mandated services, environmental health and Melissa's division. There is a series of partnerships that are in place here, both locally and at the state level, public health lab at the state level, and then our local veterinarians and health providers are all up to date and know the process that we go through when there is an animal bite that has suspected rabies, or they can't rule that out. So they know we have to do our investigation. They know where to send the animal bite report. Our veterinarians know how to keep the specimen viable for testing. And our public health lab has an extremely quick turnaround on test results. So those partnerships in place are what help lead into the next goal is that we can effectively carry out the surveillance and these investigations very efficiently because the partnerships exist and everybody knows what the next step is. Also, it's the environmental health staff that are kind of the front lines of carrying out this investigation. I have 8 environmental health specialists and all 8 of them are trained on how to analyze a bite report. They know who to call when they get one, and it doesn't have all the information they need to make a determination that it should go to Melissa or not. So having that cross training in place and them knowing what local veterinarians will be going through or how to package the specimen appropriately to the standards of the public health lab and get it sent off in a timely manner is something that we've made a point of, because this doesn't happen all the time, but when it does, it's kind of someone's got to drop everything and go do it. So having multiple people trained in this process is is in line with our goals. Cross training, everybody knows how to cover the next person. It's like, any questions?
Just curious, is it the assumption that, like, say if a domestic animal, there's a question or they test positive for rabies, that the assumption is they encountered a bat directly, or could it be, host to host, like the bat passed it to a raccoon and then the animal encountered the raccoon?
Yeah, that's certainly a possible chain of events. It can be passed down. It doesn't have to be directly from a bat. The bats are the primary carrier in Washington State. We don't see a lot of other wildlife that is a active carrier of rabies on a consistent basis.
No, I was going to add, Councilmember Myers, thank you. One of the reasons that we try to convey this information to you in the spotlights is that sometimes the information is complicated. Doesn't happen often, but potential for someone losing their life. Sometimes children losing their life. It's just why we take it so seriously. But it is the public health system at work locally within our office and also statewide and national. It really is amazing how many calls our nurses get from people who are traveling from another state who have suspected concerns. Sometimes people haven't taken it seriously and now they're worried about it. Seriously, and I'm exceedingly proud of our staff who understand the severity of these. But also, it's important for us to be watching for timely professional services. But we wouldn't want to ignore something and then have a problem later. That's one of the things that we try to convey to the state often is that we have to have trained, supported staff and the partnerships in place so that we are not ignored in our time. That's been a wonderful example, and that's something that we're trying to use for all of our examples with the state is why investing in public health systems in Eastern Washington.
And, you know, depending on the day of the week that a bite may occur that ends up needing prophylaxis. Sometimes people can get their first dose within 48 hours of being bit. That's how quick this can turn around.
And we don't wait till Monday. It can be Saturday at midnight.
Yeah.
We're working on that, so.
Any other questions? All right, then we will move ahead into agency reports, starting with Executive Director Andrew Pesco.
Well, good morning, everyone. Thank you so much for being here. I wanted to just share with you that the health district continues to work on local projects that we have in place. You'll hear from the agency reports from my colleagues, our colleagues, that we have business as usual on a whole host of things, developmental disability, health, everything is as it should be. In addition to all the work that we've been doing to be a responsive agency to the needs of the community, which is included over the past 6 months. PFAS concerns and contamination, nitrates in the lower valley. We certainly had issues with fires in not one, but 2 solid waste facilities. It's really unprecedented how many things are at play in our valley. I don't like to say that it is stabilized in our valley. I'd like to share that we are dynamic in our valley. There's many things happening. And part of our responsibility in this agency is to do the work each and every day, but also have enough flexibility to serve as a response. There was a tendency in the past, I think, in public health, not just in our jurisdiction, but in public health, being responsive to the needs of the community only in times of disaster or an emergency. And the reality is that keeping the pulse of the community at the forefront of our minds is important. So we're always thinking about what we need to do to serve others. I share that because it may look smooth sometimes, our response, but it's a lot of work internally. And I'm exceedingly proud of our team because one of the reasons we cross-train our team and allow them to understand what it is to be nimble is so that they can come together quickly and create solutions or initiatives to support to other agencies quickly and well. That's not something that happens overnight. And I do want to pay my respects to the executive team here who have worked really hard over the last 6-8 months because coming out of COVID, there's been tremendous needs in our community. Including things like concerns around opioid addiction and mental health. These are all things that we want to address. They take a long time to address, but creating initiatives, creating communication, certainly being able to communicate well with our partners has been our top priority. That's all I wanted to share. There's a lot to do in certain sessions, so we have less time. So I'll leave with that unless you have questions.
Questions? No, thank you. Thank you, Mr. Pesco. Now, Chief Operating Officer Ryan Eilbach.
Okay, there's 2 areas that I'd like to share with the board. The first is that we have activated our incident command system, our incident team. This allows us to be able to have a command structure, pull in any resources that are needed, communicate with other agencies in preparing for any larger event if it becomes above ground, making sure that we have all the emergency actions ready to go. We have started communicating with all the neighbors within 1.5 miles of the DTG landfill. We have a communication system where we can immediately put out any information needed. So that is our way that we are communicating with any of the neighbors, and also making sure that if there is an event where there is an above ground fire, then that's how they. So this by being activated in the incident command system, feel that we are prepared to manage and continue to survey, do surveillance on the subsurface fire, and then also prepare for above that. Any questions on that?
Just, who gets the notices on the incident, or how do we determine who's getting those incident command reports every Friday that you're generating?
Yeah, so we try to identify any of the partners that would need that information at any time. If there's anyone that wants to be on there, get those notifications. And, you know, if you have anyone else, and they don't include it does continue to grow as the emergency goes on.
But it includes partners, cities, decision makers in government, medical care.
First responders.
Yeah, I just wasn't sure how large this list is, because when we get it, we just see, rightfully so. I mean, the last thing we would want is 100 responses, you know,
Right.
so it's.
In COVID, we had over 500 they were sending, because a lot of people wanted that daily information. And then the smaller, like this, it might be just going out to 15 people. The incident command also allows us to expand our command, structure of command, or if there's not a whole lot going on, then we can reduce it also.
Oh, and if I may just add, we're doing the incident command structure internally for our own preparation. That's separate from a unified command, which would be county-wide. And so that county-wide unified command is what we were operating under COVID. So that's one of the distinctions we make in terms of whom we send information to.
Any other questions?
Oh, it's just, I guess, as you said, this is unprecedented for us to have 2 landfills on fire. This, I guess I should note to their credit, the DTG actually did notify when this first occurred, although I imagine they're also mandated to do so.
They are expected to do so under the process.
Yes.
But it is absolutely unprecedented. And I spend a lot of time at night before I go to sleep wondering how we could. We're in. We haven't had locusts yet, so that's good. But it is, you know, when tough things happen in a community, things change. And so we need to be.
It's good to look on the bright side. Yeah.
Trying.
And then the other item I want to share is last month I gave an update on open positions at the Yakima Health District. One position that we had open was a epidemiologist position. We had Dr. Yasmin Barrios was in that role for 2 years, and we're proud to say that she's now in that role permanently. And then we also have still trying to replace our local emergency response coordinator, and then 2 new additions, our program manager and project coordinator. Those 3 positions we are in the recruitment process. We've done interviews, and hopefully we'll be able to, next month.
Thank you. Thank you, Mr. Ivar. We'll move to Health Officer Dr. Neil Barg.
Morning. 2 small items to talk about today. In regard to the landfill issues, the first one of the problems was the release of hydrogen sulfide, which is that rotten egg smell, gas. And when you can smell it, it's actually not so bad as when you can't smell it. We talked about that last meeting. The current new fire at DTG has released small amounts of benzene, but not to the point where it's dangerous. And I just want to talk a little bit about benzene this morning. So it's people have heard of it. It's a chemical that's present in a lot of substances and naturally produced in soil. It also is in a lot of products that we use, like gasoline, for instance, when we're filling up our tanks at the gas stations. Some of the gas stations have a device that vacuums the released gases back up and recycles them. Other stations, it's just a little mouth. They put it in, it gets all over you. Right, when benzene's being released there, but you're not standing in front of that gas tank all day. So it's really related, the symptoms are related and danger is related to the amount of benzene that you're exposed to. The treatment for it is to get away from benzene. There is no drug or hospital stuff that fixes it. So it's rare to develop into a situation where there's high levels, which are dangerous. In modest levels, if you breathe the benzene, there's a number of symptoms: drowsiness, dizziness, irregular heartbeat, headaches, tremors, confusion, unconsciousness. At extremely high levels of inhalation can cause death. The other way you can get benzene into your system is eating foods or drinking materials that have high level of benzene. In this case, there's some overlap, but unique symptoms. Vomiting is one of them, irritation in the stomach lining, dizziness, sleepiness, convulsions, rapid or irregular heartbeat, and again, at high levels, there could be death. Another complication occurs if you start vomiting from exposure to benzene. You have risk of aspiration, which can cause additional problems. So there are ways of measuring benzene levels in blood and in the urine, and they are for the most part, they tell you that there was exposure, but they don't tell you how much exposure. So if there's some issue where there's benzene release, to see if there's been a population exposed, you can test them, but you don't know if they'll get in trouble with that benzene yet. In an issue of like a chemical spill, there's a large release of benzene from a tank, maybe a tanker that had benzene in it. The distance from that chemical spill will determine how dangerous it is. So the further away you are, the less benzene you're exposed to. It is a heavier than air gas. So if there's a benzene release and you're living in a valley, downwind of that, you're at risk for getting high exposure. Whereas if you live up on the top of the crest, it's not as dangerous. So ongoing monitoring is taking place at the facility to make sure that the levels stay low or even dissipate as they bury more and more of the fire. So happy to take any questions regarding benzene.
Go ahead. I've got a question. So, what in the landfill would be contributed to this? I mean, is this expected or unexpected?
Well, I don't know if anything is expected. It's just that when there's fires and there's material down there, the benzene can be released. And it's the same with the hydrogen sulfide, is the materials are there. And with the fire, depending on the materials, certain chemicals are released. So the materials that are in the DTG landfill are composed of something that probably contains benzene.
And Commissioner, I think our first point of concern is to remedy the fire, and the second is the issue of what could be causing it.
Yeah, just to clarify that is we're addressing there's a Monotoxics Control Act in place out at DTG. It's also known as MONCA. It's basically a state cleanup site because of the releases of the gas, the exceedances and like benzene levels. However, the fire complicates that investigation and the cleanup of that. They feel the fire is related. So we're addressing the fire under our solid waste permit in partnership with Ecology, much like we did with Caton, as an emergency interim action to the MONCA process. So we're addressing the fire, getting that under control, and then the state will pick back up with the investigation under the MONCA authority. But just to, DTG also in years past, under previous ownership, had a petroleum contaminated soil remediation site. When those soils were remediated to low enough levels, they would oftentimes go into the landfill, which was allowed, but some benzene could be being generated from those past remediated contaminated soils. Gasoline soaked oils. That could be contributed, but just to offer some clarifying points on what's going on.
Another thing I didn't mention, when it's in the soil and it rains, it will take the benzene down into the water table. So any downflow water could be contaminated with low to high levels of benzene, and that's how you would get it ingesting. So kind of like PFAS, if you know that's in the water table, that you'll have to get bottled water from another source. So the second thing I want to talk about is improvement with the COVID situation. The Department of Health, as of April 3rd, has rescinded the requirement to wear masks and only recommended certain areas. What's that base is on the level of in the community. Right now, we're at a low level. In the future, with the dismantling of the reporting system, because of the ongoing costs and the fact that everything's improving with COVID, we won't know whether we're low level or not. So, but at least for now, we are. And the mask recommendations really are limited to indoor activities and public transportation. If you look at our buses, there's not that many people on them, so it's pretty decent if you weren't wearing a mask. But if you're going to a Mariners game and you're on the light rail, it's shoulder to shoulder in there. So it's interesting. A lot of people do wear masks in that. And I think King County may be at a higher level than Yakima County, but probably not by much. If it is, there's decreasing numbers of people hospitalized in King County. And of course, here we have many days of zero hospitalized. So things are really cooled off. The only other time that masks are recommended is if you actually have COVID. So if you're feeling better and you test negative with an antigen test at day 5, they recommend you wear a mask for 5 more days, either an N95 or a good quality surgical mask. And with the numbers going down, there's less issues there. So that's really it. It's good news regarding COVID. And it's just a little more flexible now with where you need to wear masks and where you don't need to wear masks. If there's any questions.
And then thank you, Dr. Barr. Next is Jay Porter with financial report.
Good morning, everybody. The financial report starts on page 8. I have a couple of items before we dig into that. For budget awareness, at the end of every year, budget is approved for the following year. Last year, we did not budget a large land purchase. So if that does move forward, there's probably going to be a need for a budget amendment. It won't need to be right away. But it will probably happen later on in the year, September, October, if that purchase does go through. That'll be something that we'll have to do maybe a little bit later in the year, just for your awareness. Secondly, we have an audit coming up. So at the end of May, we will probably start state auditor's office, SAO will be here planning, and then the field work.
I may add, we pay for the privilege of an audit. So we welcome them and we pay.
It's required annual, or is that just?
Yes, yeah, there are certain requirements. If we have over $750,000 in federal funding, you're required to have one. We've had that year over year for since I've been here. If we had less than 750,000, we would probably be in every other year. But we generally generate quite a bit more in federal funding than that. Hey, moving into the financials, we had a large gain for the month of March, 272,000, bringing our total excess revenue up to $626,000. Our allocated budget for revenue for the year was just under 2.5 million, and our actuals at 2.5 million for revenue for expenditure, 5 million as well, and our actual expenditures coming in closer to 1.9 million. If there's any questions, please go ahead and ask. Can move along quickly for that session. Moving into the income statement, just looking at the monthly differences for our federal revenue, we were over about $100,000. That was we received max billing, Medicaid administrative claims for our highly compensated employees, i.e., our nurses. We get a reimbursement for that. We were in arrears with that, so we're catching up with that billing, but that was $150,000 for the month of March, and so that's driving our large gain. Most of our expenditures are coming in slightly under budget for the month and the year. Is there any questions for this part of the financial statement? All right. Moving into the next page on page 10. We have spent up all of our FPHS funding that we were carrying over from last year. We were carrying over 440,000, and we've all spent that all up, and we are moving into current year FPHS spending. Are there any questions regarding that? Okay, moving into programs. The FPH section, I think we identified that color as clay. As you can see, the majority of our FPHS now is being fully funded with current year funding. We will continue to have those differences throughout the year for showing them as a loss, but again, that's just last year's funding paying for this year's expenses. Large gain for medical admin is number 295, which is down in that peach section in these little numbers. Is there any questions regarding program statements? Moving into the next page, spring has certainly sprung inside of EH. We have gains pretty much in all the programs for the month, bringing our annuals into smaller gains, but certainly seeing uptick in EH activities, certainly for on-site solid waste, drinking water. They have been busy and it shows. Questions regarding projects? COVID income statement. Again, not a lot to note here. Dr. Sergeant Barber saying we have not had a lot of activity, mainly advertising promotional with some employee costs. Yeah. Any questions regarding COVID income statement?
There's the 693,000 on the difference for federal. That's not funding that we haven't utilized yet. You're just comparing to last year.
No, this is our current year budget, and we have budgeted. We generally, for COVID activities, we budget high. So it's not comparing to actual funding that we have, but what we thought we would be spending for this current year. And we would like to have, some leeway if things do pick up for whatever reason, if there is a spike or a new variant.
But there's no threat of federal funding being returned, COVID money being returned or anything of that.
No. COVID money is cost reimbursement. So we get it after we spend it.
Commissioner, I should indicate that really some of our large funding streams from the federal government and the state are drying up.
Yep.
So we won't have them. We'll have certain amounts of money that were already allowed to a certain time, one of them being March of 24. But most of the money.
Yeah, and we'll kind of continue to see that into next year. We do have some dedicated funding into 2024. But after that, there's not a high possibility of that being renewed. The FEMA funding has already discontinued. We've already stopped with the FEMA funding. Questions? Last but not least is the cash flow. We saw a slight uptick in cash. We went from 12.5 to 12.7, which is a bit of a surprise. Generally, we start up high in January and tick down as we receive public health funding, about $500,000 in January and July. So generally, we see a spike in January, then it kind of ticks down to July, and you see another spike and it ticks down. Just a little bit of an increase for this month had a lot to do with the MAC that we're talking about. Cash flows. That wraps up my report. Thank you.
Thank you, Mr. Carter. And so now we'll go through disease control. My report brief.
Currently just managing one active tuberculosis case. Really the only notable thing in communicable disease going on right now is we are seeing a little uptick in our salmonella cases, which is pretty typical for this time of year because everybody's buying their baby chicks. So that's the only thing really notable, other than I'll add to Dr. Barr's report on COVID-19. On May 11th, the emergency for the pandemic will be declared over. We will continue to follow the CDC and DOH guidelines as they change.
Questions from Melissa? Hearing none, thank you. And we'll move to environmental health with Sean McGee.
Good morning again, everybody. Start off with a piece of new information that we just learned about last few days. And in the final minute of the final hour, we were in with the Guama Implementation Committee. Public Services Director Lisa Freund was frantically trying to put together a grant submittal for some funding for the Lower Yakima Valley Guama projects that are going on, and we got the submittal done, and just got reported back that that grant was approved. So we have quite a bit of new funding coming in to the help serve the efforts in the lower Yakima groundwater management area. So Yakima County being the lead agency on that grant, but certainly looking forward to partnering with them and bringing further education, outreach, potential well testing, all sorts of good work that can be done down there with those dollars. So excited to report that out to you all. I believe it was in the amount of 850,000. So that's a sizable piece of funding to help our efforts. Moving on to other EH things, our everyday field work, Chase is right, it is getting busier. We're seeing a lot of land development activities. Staff are running in and out of the office. The cars are dirty, so yeah, we're all over the place, Upper Valley, Lower Valley, and getting to a point where there's not as much snow on the ground, so we're even seeing some development up on the passes. So we're traveling far and wide to give people the inspections they need to move forward. And it's also lots of conferences and trainings in the spring, so we're kind of trying to send staff as we're able to some of these trainings and just come back and help other people learn in other programs as well. So lots of good things happening this spring in EH. Moving into the solid waste component side of things, as talked about a little bit ago, we do have the subsurface or EPD. We're activated in our incident command structure. What that means for EH is that two of our environmental health specialists who work heavily in solid waste are out there periodically. Not as much now that we have the ongoing monitoring in place, but now it's more their help analyzing the data and making sure the data is coming in a timely manner, communicating with DTG, making sure they're aware of what they need to be doing on a daily basis and getting that information back to us. So we're kind of keeping them honest in a way. Yeah, it's taken up some time for a couple of my staff, but they're well suited for it. And yeah, just trying to make sure that we have all the different aspects in place as far as their solid waste permit goes, operational wise. Landfill staff is safe, the neighbors in the immediate vicinity is safe, and then utilizing the incident command team or incident management team to deal with the evacuation components if it ever got to that point, or the communication of components, and having all the other partners involved where they need to be. So right now, contained and it's all underground, but we're prepared if it gets bigger than that. So we're also in renewal season for our facilities, so we're working heavily on reviewing and evaluating different documents for both of our limited purpose landfills. Trying to get those documents reviewed and give feedback to the facilities to allow them to make corrections or updates to different documents as they are needed. Yeah, business as usual on that front. We're just conducting our reviews and getting back to our solid waste facilities on what they need to get done for the renewal.
John, those renewals, are those annual or like every 5 years or?
They're annual. Yes.
Any other questions for us, Maggie?
Not a question, or maybe just a comment. I want to circle back on the whole issue with the Guama funding. This is really a good shot in the arm for that project to get that state funding. And I think I do want to recognize that Lisa Freund did a good job at trying to secure funding for that. Also, I do want to mention Senator Mark Schessler. Also, our own Senator Nikki Torres from the 15th District was instrumental in that, as was Senator Judy Warnick and our Representative Brian Sandlin also. So got a lot of local help getting that done.
Thank you for noting that. All right, thank you, Mr. McGee, and we will move to public health partnerships.
Thank you. So I'll give an update related to the Developmental Disabilities Program. So as you all recall, the Yakima Health District does administer the Developmental Disabilities Program for Yakima County. And a couple years ago, in 2019, we piloted an initiative called Start Now. And what Start Now was a program developed for families with middle school children with developmental disabilities, with the idea that it would be an early preparation for later, which was for a time frame referenced as the transition period. Transition being the transition from public school to either education or some other post public education time activities for the families. And so back then we piloted that initiative with Sela School District. It was very successful, but as we all know, 2020 and 2021, we weren't able to expand due to different regulations. But this last year, we were able to expand into the Lower Valley, which was our intent the entire time. So I'm happy to report back that now Wapato School District and Toppenish School District have implemented this Start Now program. And it's a wonderful resources both for the families and the teachers, because it is rather complicated. Once you start looking into what does life look like after high school, there's lots of agencies you have to work with, lots of policies and procedures that you have to be aware of. And for many of our families that may not have English as a first language, that even adds to the complication as well. So this program is to get an early touch point for families and to be able to, one, get students comfortable with the idea and thinking about life after high school, that there are lots of possibilities for them, but also for the families to get comfortable on who the people to talk to are, what the agency are, and what to expect as well. So that's a bit of good news that I wanted to share with you all, that's our goal, is always to reach as many families as we can, as early as we can, recognizing that we are just one role of we're just one agency that can help navigate the maze of processes that these families will have to go through, but also that we want to make sure that these services are available across the county, as we know that the Lower Valley traditionally doesn't have as many resources available to them. So we're very thankful for the Sela School District, Rebecca Fuss specifically. She's been a great mentor to these other schools, and we hope to continue to expand as well.
Thank you. I'm sorry, sir. Go ahead. I'm just going to recognize the investment that the developmental disabilities team are making, and Will in particular, to not just meeting the expectations, but to options that are available for families. These are families that always need our assistance and recognize the value in a collective effort to care for their children. So what we're doing is creating innovation within traditional government structures that are usually non-existent. And at this point, the team for that's something that we do often, but this is very, very necessary for these families.
Just the engagement with the schools. So is it like, do we have health district folks going into the schools, or is it just like a curriculum that the teachers, the Start Now program, and they just implement that program themselves?
Yes, it's the latter. So what our role is to provide the funding, provide the curriculum. For example, the curriculum came from King County. So we helped to modify that for Yakima County. And again, knowing that in Yakima County, we have so many families that are Spanish speaking, we paid for the translation, paid for all the necessary infrastructure. But ultimately, we rely heavily on the investment from the schools themselves to provide the staffing. And again, such as Rebecca, she's really the one who spearheaded this. So we're thankful to the Sela School District for allowing her time to be able to be a mentor for the rest of the schools. But by and large, the big pull and effort comes from the school districts themselves, which is again a commitment to their community. And our role is more to provide the infrastructure and coordinating the resources to be able to make that happen. So it's very community-based, honestly, in a way.
You know, if the Yakima School District is interested in doing the program?
Not at this time, but it is something that we're always working to get other school districts to move forward with.
And if I may, this is an example of something that Lily and I have worked on for years prior to COVID, which was the concept of what we refer to as a rural health innovation catalyst. Where is the need in our community? Who are the players at the table? What do we need to actually make it work? And who are the partners that can actually implement it? This is public health, true public health in effort, but it's not us doing the work. It's us supporting others to do, which really has more of a collective impact. That's what we're trying to achieve. It's not about growing the health district or even our programs. It's about strengthening the support system for families.
Yes, because again, that allows us to look for other school districts, like you mentioned, the Yakima School District, we're trying to provide the resources for them to be able to take it on and expand even further. Thank you.
Thank you, Lillian. That's all the questions. And then we move to our agenda item 8, which is unfinished business. Then we'll move to item 9, which is new business and discussion of.
Thank you so much. Thank you again for your patience. It's been a long meeting, but we appreciate your time. And Ryan, please feel free to jump in on this. We are fortunate to have received additional funding during COVID and certainly after COVID to allow us to transition into more community focus for our partners and certainly for the community. That's meant more staff and hiring more folks, that Ryan has mentioned. But we also recognize that no matter how proud we are of this building that we're in, we're reaching our capacity in terms of the number of offices we have, and we find ourselves working on multiple initiatives, as we've discussed, community service initiatives that allow us to work together in terms of training team approach, but we often don't have the space for it. So we're looking at not only expansion potentially for what we need in the next 5 years, but also to have a footprint for really robust public health infrastructure in the future. So we started those discussions in earnest over the last few months to recognize that we have additional funding. Specifically, some of that funding is called foundational public health services. Again, that's money that's coming from the legislature to strengthen and increase the fundamental programs in public health that we require. That's a collective effort for the entire public health system. That's the State Board of Health, tribes, the State Department of Health, and local health jurisdictions like ourselves. It's a collective public health effort, and we've received funding over the last few years. That funding allows us to have more nimble investments, including infrastructure like a building. So we've looked at options. We talked about with the board the potential for options of purchasing land. We're now looking at potential options to purchase a building. Again, we have funding that's available. It's a timely effort, and we are concerned in fairness that if we expand more and hire more staff and take on more initiatives, that we won't have the room for that. The other recognition I want to share with you in earnest is it's our priority to make certain that people pay attention to Eastern Washington, and specifically Yakima County. And so one of the things we'd like to have is more space so that we can encourage the state to invest in training in Eastern Washington, so that we don't have to send staff to the west side. We can actually have recurrent training here. We'd like to have space to involve more community members. As Elaine just mentioned, we talked about an initiative that includes families of people who live in this valley. We'd like to have more engagement with those folks, and we'd like to do it here, and we'd like to open that up as well to social service agencies. So we're looking at options for investment. We're looking at investment. Happy to answer questions that you may have, but we would like to move forward with engaging some building owners to determine whether we can actually make a purchase. So we'd like your thoughts on that and your agreement that we can move forward. And then we can certainly discuss if you want us to move forward with a purchase with funding that we have, or if you'd like us to come back to you for perhaps a special board meeting to have those discussions about actual purchases. I don't know if I've shared enough information with you, but I'd certainly welcome your thoughts behind it.
Yeah, so I'll just add that, as we started exploring different options that we had, it was brought to our attention that there was a big building right behind us in the same business park that we're in. And that building is 5,184 square feet. And that building and adjacent lot is what, about 1.8 acres.
So we're not looking to purchase a massive building. We're not looking to lease space to others. We're looking for a place that will allow us to expand, to have more options for the services we currently provide, and then envision what we do in the future when we hire more staff. So there is a building that's available. There's other options that we can certainly discuss. We want to be sure that we provide services throughout Yakima County. That includes the Lower Valley. So we look forward to your thoughts and happy to answer any questions you have.
I do want to point out that part of the discussion this morning was also looking at potential Lower Valley expansion. I think that's.
Oh, yes, that is part of our focus. Lower Valley expansion is necessary. We want to make sure that we provide services equitably. Part of the reason that we want to have a strong footprint and own property is that we can then provide those services throughout Yakima County. And also, I should mention, we do have access to funding that is available. It's timely funding. One of the reasons we're interested in making purchases now is we envision that with hiring of more staff, we may have less flexibility to make purchases like this. Obviously, if we do hire more staff, we find places for them to work, and it is getting quite tight.
Well, Andre, I can attest to that, having gone to the building recently. I know that we kind of got people piled on top of each other a bit here, so I think it's maybe a timely opportunity, with the increased capacity, diminished space here, the opportunity to expand and look at options. It seems to be timely, also having the funding available. I do think it's been brought up that, the idea of having something close by makes sense to look at that. On the other hand, the idea of, although this is the population center of the county, there's certainly a lot of population in other areas of the county, including the Lower Valley. I think it's worthwhile to look at things out.
We're happy to entertain any thoughts on building purchases in the Lower Valley, if you have some other options. We do have some funding that will end in the end of June and into July. So we're looking to make a move in a timely fashion. But again, our goal is to make the right decision. And what we're seeking after we discuss is, as long as you wish, is your approval to begin the process of negotiation.
If I may, just a question on the expiration date of the funding. Do we know if it's worded in the sense of it must be spent or it must be allocated? I mean, because there's difference with.
Yes. In fairness, we have two funding sources that we're fortunate to have at our disposal. One is from the Initai Foundation, which was formerly called the Group Health Foundation. And that's, I think, $397,000. And by the end of July, we have to have a report to the foundation. They have allowed us to make investments as we see fit. But I did feel prudent to discuss with the about an investment like this. They felt that was appropriate, that having a foundation of a building and it's paid for, it means that our focus and services will be on others in the future. We're not spending on leasing, and we certainly want to have access. We mentioned our interest in being a responsive community agency, and that we've hired more staff to just do that purpose, which has been a tremendous investment of money already. They recognize that. They give us their approval. The other is Foundational Public Health Services, which is quite unique, and forgive me for the bureaucracy, but essentially the state has allocated money to the public health system. We, in negotiations, were allocated as local health jurisdictions a specific amount that was given to us, what we would call base plus, a specific amount of money plus our population size. We've received money now for a few years. We have that money and we're allocated a certain amount of money. However, an invoicing system, they've given it to us, and if we don't spend all of it, we give it back. That is very unique. Normally, you're either given money that you have full control over, and that money then can go, if you don't spend it all, into bank reserves, or you invoice. This is quite unique. So it's literally been given to us, and it's made clear that it doesn't go back to the system, it goes back to the legislature. We could have given potentially the money to the system, but it's definitely the legislature's money. So that's why if we don't spend it, we lose it. We have been conservative with that money for the very reasons that we've been encountering, which is emergencies. We have spending money on our responses for the Caton landfill, for BPG, certainly for monkeypox. Whenever we have these, it allows us to be nimble, because normally in government you have very categorical funding and you don't have access to funds like this. This has allowed us not to have to use reserves, but the money goes away June 30 specifically, and the end of July we have to have an explanation to the Initai Foundation. So your question.
Yes, I actually would move that we authorize Yakima Health District Administration to enter negotiations and purchase a property and or facilities with the spending authority capital level mentioned in executive session.
Second.
So we have a motion and the second. May I read your motion, please? I didn't write it down.
Sure.
So we have a motion and a second to give the health district, right, authority to can't read your writing. I'm
Sorry. I can read it. Okay. Yeah, motion that we authorize Yakima Health District Administration to enter negotiations and purchase a property and or facilities with the spending authority capped at the level mentioned in executive session.
Thank you so much.
Look, Don, with your handwriting, you might have a bright future as a physician.
Right.
Do you have any further discussion of your motion?
No, not really. I just think that we have, I think we have a timely opportunity with, with the juxtaposition of staffing and capacity needs, funding available and options to look at.
Any comments?
I would just support that the goal of this organization is to further the public health interest of Yakima County. In order to do that and facilitate that, you need space, you need buildings, you need people, you need manpower, and you need a lot of drive. So we can help them in some of those things, and then Andre and his team will help us find individuals that continue to serve the mission. So I think it's a good timely money well spent at this point. So I would support it.
And
Any
I'll-
further comments?
I'll go ahead and add that I think this is a move. It is a strategic move for the health district in the sense that will allow us to further expand capacity as needed, as new programs are rolled out and as new focuses emerge in our public health sectors.
Any other comments? Lupita, I'm wondering if you have anything you would like to ask or comment at this point?
I do not on this topic, but I am excited that we are going to be expanding because I think we can really say it's a we effort and it'll be good for the community and for the health district staff.
Thank you.
Councilmember Wise, I'm looking for a point of clarification. You're approving or with negotiations, if the board wants to entertain the second motion, come back to special meeting, perhaps to discuss decisions on purchase, if that's to your liking.
Well, I put the motion out, we're allowing you the authority to negotiate and purchase as long as you stay under the room. That was the nature of it.
If you're all comfortable, I just want to make certain that you are.
Any question about that?
Just to note that should it go above the limit, then a special meeting would be called. Yep.
Certainly. Yes, thank you.
All right. If there's no further discussion, we'll take a vote.
Okay, if you're in favor of the motion as stated, please signify by saying yes. If not, please say no.
Yes.
Commissioner Curtis,
Yes.
Edie Dibble,
Yes.
Dr. Atterbury, Aileen Ackerman,
No.
Stephanie Algren.
Yes.
Councilmember Carrillo
Yes.
and Councilmember Byers.
Yes,
Vote is 7-1.
motion passes and 7-1. Thank you, everyone. Appreciate that.
Thank you.
I see nothing further on the agenda. So I'm going to just move to adjourn the meeting until the next regular scheduled board meeting on May the 31st, 2023. We're adjourned.
Got it.